Welcome to The Explainer. So, you're looking to provide truly holistic client care and foster deep, genuine empathy? Well, you are in the exact right place. Today, we're unpacking the incredibly diverse categories of disability and chronic health conditions. This is going to completely transform the way you approach client support, so let's jump right in.
Okay, let's dive into this. Here's the roadmap for our explainer today. We'll kick things off by looking at why disability is not one size fits all. Run through the 4 major categories, and then get into chronic and invisible conditions. After that, we'll explore the individual experience, walk through a case study with someone named Jordan, and finally bring it all together by looking at how to understand the whole person.
All right, Section 1, disability is not one size fits all. Unique experiences.
Listen, a medical diagnosis, it absolutely does not dictate a uniform life experience. You could literally have 2 people with the exact same condition on paper, right? But their actual lives look vastly different. Why is that? Well, it's because someone's experience of a disability is shaped by a whole complex web of factors. We're talking environmental barriers, the strength of their support systems, their access to healthcare, their culture, and their overall mental health. A diagnosis is really just a starting point. It's the context of a person's life that actually defines their experience.
Moving right along, Section 2, the 4 major categories of disability. Let's look at the classification framework.
So the first major category we have is physical disabilities. These are basically long-term or permanent impairments that affect the body's physical functioning, movement, coordination, or even stamina. This covers a really wide range of things, everything from spinal cord injuries and muscular dystrophy to cerebral palsy, multiple sclerosis, and arthritis. Now, some folks with physical disabilities use highly visible mobility aids, wheelchairs, prosthetics, or walkers, but, and this is key, others have impairments that are way less visible to the outside world, but they absolutely still impact their daily functioning and independence.
Our second category is psychiatric disabilities. These are mental health conditions that significantly affect emotional, psychological, behavioral, or social functioning over time. Think major depressive disorder, generalized anxiety disorder, schizophrenia, or PTSD. The absolute crucial point here is that we have to recognize psychiatric disabilities as very real disabilities. They can vastly affect someone's concentration, their motivation, relationships, pretty much their whole quality of life. And unfortunately, these conditions are often weighed down by heavy societal stigma, which just throws up even more barriers when folks are trying to get support or basic accommodations.
Next up, the third category, sensory disabilities. These involve impairments related to how we take in the world through our senses. The most common examples are blindness, low vision, deafness, or sensory processing difficulties. Our senses dictate how we navigate and socialize, right? So an impairment here fundamentally changes that interaction. But I want to pause for a second because this next point is absolutely vital. Within deaf culture, for example, deafness is often not viewed as something negative or something that needs to be fixed. Actually, it's embraced as a rich, cultural, and linguistic identity. It's just a brilliant reminder of why we always need to respect lived experiences instead of just imposing our own assumptions.
And our fourth category is developmental disabilities. These are conditions that are typically present from birth or early childhood. Think autism spectrum disorder, Down syndrome, intellectual disabilities, and certain learning disabilities. These can really affect how someone learns, interacts socially, and manages independent living. But, it is incredibly important to actively recognize and support the unique strengths, the talents, and the vibrant perspectives that individuals with developmental disabilities bring to the table.
Let's move to Section 3 and see how this builds. Chronic and invisible conditions, the hidden health conditions.
You see, chronic pain is a massive, complicating factor in all of this. We define this as pain lasting for more than 3 months, and it might just keep going long after the initial injury or illness has actually healed. And chronic pain doesn't just stay at one level. It fluctuates wildly. It destroys your sleep, ruins your mood, and heavily affects employment. But the truly heartbreaking reality for a lot of people, because the pain is completely invisible, they are constantly subjected to disbelief from others. They're suffering immensely, but because they look fine, the world just assumes they are. Which naturally leads us to this vital list of invisible disabilities: diabetes, lupus, cancer, fibromyalgia, chronic fatigue syndrome, traumatic brain injuries. These are significant, life-altering conditions, but they aren't outwardly visible. And because they aren't obvious, people frequently and wrongly assume the individual is perfectly fine. This skepticism creates so much secondary trauma. It causes stress, shame, and isolation for someone who's just trying to navigate their day. As counselors, or honestly just as empathetic humans, we must never rely on appearances to gauge someone's struggle. Seriously, never.
All right, Section 4, the individual experience. going beyond the diagnosis.
Because getting a diagnosis isn't the end of the story. Honestly, it's barely the beginning. Just think about person A and person B. Both of them have the exact same medical diagnosis. Let's say it's major depressive disorder. But look at their lived experience. Person A works full-time, needs minimal accommodations, and maintains their daily routines pretty well. But person B, they're struggling significantly with basic daily functioning. Their motivation is low, and their employment is highly unstable. Same exact label, totally different reality. We can't just manage labels. We have to work with the unique, actual person sitting right in front of us.
Okay, Section 5. Let's look at a case study to really apply these concepts. Meet Jordan.
So here's Jordan's context. Jordan is living with chronic back pain following a workplace injury. This is a classic starting point, right? A physical impairment. But as we've been talking about, a physical impairment doesn't just happen in a vacuum. It ripples out and affects absolutely every other area of life.
And this brilliantly illustrates that cascade effect. So on one side, a physical injury brings immediate, obvious impacts: ongoing pain, severe fatigue, sleep difficulties, and reduced mobility. But those physical realities, they trigger profound emotional and social impacts. Because of the reduced mobility, Jordan is dealing with financial stress and social isolation, which has then triggered symptoms of depression. On top of the whole thing, Jordan feels super embarrassed to ask for accommodations at work, basically terrified that his employer or coworkers will just view him as lazy. So what started as a physical injury is now simultaneously attacking his mental health, his identity, his self-esteem, and his livelihood.
Which brings us to our final section, Section 6, Understanding the Whole Person, providing holistic client care. If we truly want to support someone like Jordan, we have to address both the physical limitations and those deep feelings of hopelessness. So I want to pose a question to you, and I really want you to think about this for a second. How can counselors, or really, how can any of us, avoid making assumptions based on a diagnosis alone?
Well, effective counseling begins by understanding the person behind the diagnosis. How do we actually do that? It's through boundless curiosity, genuine empathy, active listening, and cultural humility. We have to treat the whole person, not just the label stamped on their medical chart. As you've seen, disability experiences are shaped by an incredibly complex mix of internal and external factors. So, as we wrap up this explainer, I want to leave you with this one provocative thought. The next time you learn about someone's diagnosis, will you just see the label, or will you have the courage and curiosity to see the entire world of the person living behind it? Thanks so much for joining me today, and keep learning.